The focus of my research program is to improve quality of life and participation of people with physical and/or cognitive challenges. My approach to that is to develop technologies to keep people at home and to deliver rehabilitation services at home so that they don't come to the hospital. The first stream of my research program is to monitor the inhabitant at home. The main idea in terms of technology is to use a wireless motion capture system to monitor the patient or the research participants at home with the goal of monitoring their behavior. Some of the behavior can be dangerous, so we can monitor any movement that we think relevant to report to a caregiver or to a healthcare professional. My research, I'm looking at opportunities to deliver at-home telerehabilitation services for people with neurological conditions. The first version of that is to deliver at-home telerehabilitation for people with stroke. So when we have someone living with stroke, they will go into surgery and some inpatient services, and then they go back to the community without full services at home. So my research program tried to cover this gap in the rehabilitation path. We have invented a couple of technologies to deliver rehabilitation services at home. The first part of the program is a 3-month program using a tablet and a virtual reality headset. So the tablet part of the program will target physical training. The user will involve in physical training program targeting the upper limbs and the lower limbs and some cognitive tasks training. The other part of the program is virtual reality enabled. So the user will put in a headset on their head and they have a couple of controllers and they will be involved in training targeted activities of daily living in an environment that is a simulation of this kitchen actually. The next part of the second stream of my research program is to recover hand function. Once the person with stroke, for example, has benefited from our first program on tablet and virtual reality, hopefully, we will aim to recover hand function also at home. So we invented iManus. iManus is a smart glove and the platform enables hand rehabilitation from a distance. So the user will have a smart glove and an application running on a mobile phone or tablet, and the therapist will get a desktop application. And this way the therapist and the patients can engage in a therapy remotely. And we have created a new modality of training that enables synchronous training or asynchronous training. If we go for asynchronous training, this means that the user is training by himself without assistance by a therapist. They are engaging in therapy. They will involve in programmed tasks, pre-programmed tasks that can be customized, and the data will go to the therapist in all cases. In the second modality of intervention, the therapist will be present. All those digital health solutions are backed by cloud services to enable us as a researcher to get the information from the therapist and the user so that we have real-time data and we can process the data and we come up with customized solutions for the clients.